Hello, my name is Dr. Marvin Buehner. I have been practicing OBGYN for 18 years, 15 years of that here in Rapid City, South Dakota. Well, I've had patients in my career who needed to have the option of considering terminating their pregnancies for a number of medical reasons, for a number of social reasons, and occasionally because their babies have abnormalities that prevent them from surviving outside of the womb. I've had patients who had cancer during their pregnancy and needed to consider terminating their pregnancy to begin treatment. I had a 38-year-old patient with a rectal cancer diagnosed at approximately the same time as their 13-week pregnancy. And in order to begin her chemotherapy and pelvic radiation, she needed to have the option of considering terminating the pregnancy first. This was a patient whose contraceptive had failed. She was in her mid-30s, she already had children, and she had to weigh the obligation and responsibility that she had to her other children and her husband with her responsibility to the pregnancy, and had to make decisions about her health care that this measure would have interfered with. I have had patients with heart disease and that became accidentally pregnant when their contraceptive failed. Again, they had a family to consider, and they had to consider the possibility that they could die during this pregnancy if they weren't allowed to terminate. Again, this measure would interfere with this patient's ability to hear the full range of options and for her physician to be able to provide those services. I've had a number of patients with abnormalities whose babies had abnormalities that are not compatible with survival outside of the womb. For example, a baby with no brain, or a baby with a set of chromosomal abnormalities that precludes life outside of the uterus. Under this bill, there are no exceptions for that, and they would be forced to carry their pregnancy to full term when the risk is considerably higher than terminating earlier in the pregnancy if they so chose to do that. I'm voting no on 11 because I want to protect my patients' rights to good medical care and the full range of treatment options in pregnancy complications, and because I agree with the majority of South Dakotans who think the government should stay out of the personal medical decisions of its citizens.